Did you know that in our country in 2022, 421,400 individuals were homeless? 127,000 of those were considered chronically homeless, meaning they had been homeless for over a year or more. Today, I'm going to inform you about the chronic homeless population that lives right here within our community. I've been working with the homeless for over 10 years now through a ministry where we are feeding and ministering to the homeless every single Sunday. I have gotten to know some of these individuals personally. I've heard their stories, and I can understand why they are homeless. First, I'm going to tell you about the kind of people that we see in our homeless population. And second, I'm going to tell you why we are seeing increasing numbers. Who are the people that we are seeing homeless in our community? The number one age of homelessness in America is infancy. We are seeing more of our babies in homeless shelters and on the streets due to the rising cost of childcare and only one parent in the home being able to work. Every year for the past 10 years, my husband and I have been doing a homeless Christmas drive for children at the Family Gateway. This is a homeless shelter here in our community. Up until 2020, we were seeing anywhere between 30 and 40 children that we had accounted for within that shelter. Between 2021 and 2022, there was over 100 children in that homeless shelter alone. We are seeing veterans who have served our country homeless and living on the streets. People are suffering with mental illnesses and addictions. For our veterans who serve our country, most of them receive an SSI check. And every month that SSI check will not cover the cost of rent and their daily needs for an entire month. There's roughly 365 veterans in Dallas County this year that are homeless. That is up 21% since 2022. Addiction runs deep within our homeless community. Most of them have lost their jobs and their homes due to their addiction. Among these with addiction, there's also people suffering with mental illness that has gone untreated by professionals. And these individuals are now self-medicating with drugs and alcohol in order to cope with their mental health issues. Now I will tell you why we are seeing the homeless population increasing. We have been seeing the homeless population increasing over the past few years. As a person who works within the homeless community, we are encouraged to push these people by the Dallas Homeless Coalition into shelters. And all of that sounds great. But even if we were to send all of these homeless individuals into a shelter every night, some of them would still be turned away because we do not have enough beds to provide for each homeless individual every single night. The increasing numbers of homelessness in Dallas County can come from a couple of different reasons. The Dallas Morning News put out an article in April of 2023 where it stated that between Dallas and Collin counties, they received $2.2 million in funding annually to provide homelessness services. With $2.2 million in funding each year, the county still struggles with affordable housing and mental health services that are keeping individuals homeless and on the streets. We don't have enough affordable housing that matches the income. Our average minimum wage in Texas is $7.25 an hour. Assume that someone works 40 hours a week. Their gross pay is $290. After taxes, let's just say they bring home $250 a week. That's $1,000 a month. If you want to rent an apartment or a house, most landlords require you to make 3 times the amount of the rent. At $1,000 a month, that would mean that a family would have to find affordable housing for $300 a month. That's just not realistic within our world today. 7.7 million people in America right now are paying more than half of their income for rent alone. Not only do low-income Americans not make enough money to afford housing, but we don't have enough affordable housing to accommodate everyone. Mental health has also taken a toll on our community as a whole, but within the homeless community, about 43% of individuals have a severe mental illness. We are seeing hospitals overpowered by homeless individuals due to self-harm or manic episodes. Our jails are overcrowded by mentally ill patients who have committed petty crimes. And even if there are mental health service referrals given or sent for services, there are extremely long wait times. So these individuals are given a small amount of medicine and sent back to the streets. Without having a physical address or a phone in order for them to call when services are available, they go without services and they're actually back to square one. 38% of our homeless population in Dallas have addiction to drugs or alcohol. This increases as the homeless population increases. How these individuals became addicts, we don't know. It could stem from past trauma. It could stem from trauma that is associated with being homeless. These individuals need more than just affordable housing. The treatment options are slim without insurance and to pay for services. Resident rehabs run by the state, or those that can provide services without insurance can only accept individuals if they have availability. So what does that mean for individuals in the meantime? We cannot house them in a hospital. And oftentimes they are released or they get services once they are arrested for committing a crime. They're sentenced to rehab. When they're sentenced to rehab, once the rehab is over and they're released back to the streets to start the vicious cycle all over again. Homeless individuals have resorted to living on our sidewalks and in encampments. As a ministry, we have attempted to help homeless individuals get into housing programs and go into shelters. We see them right back on the street within weeks. And each one of them says one of two things. They did not provide the services that I required, or the rules that they have are unrealistic. Today, I've informed you about the chronic homeless population that live right here in Dallas County and why we are seeing the numbers increase. We talked about the kind of people that we're seeing in our community that are homeless and why they are becoming homeless and staying homeless. It's time for us to come together as a community to reduce the homeless population. These individuals are someone's mother, father, son, or daughter. It could be one of your family members. It's time to end the biggest war in America and in our community, and that's homelessness.